If your gut is in a state of chronic defense, your brain cannot experience peace. Over 90% of your body's serotonin is manufactured by enterochromaffin cells in the gut, heavily managed by your microbiota. When gut microbes sense an unsafe environment, whether from chemical toxins, poor nutrition, or chronic sympathetic stress, they trigger a local cell danger response, disrupting neurotransmitter synthesis and sending inflammatory alarms directly to the brain. Conventional psychiatry tries to treat this exclusively in the skull by forcing synaptic serotonin with drugs. It is a profound mismatch. You cannot heal the mind if the gut is screaming danger.
And welcome everybody back to the Health Optimization Medicine Podcast. Your clinical team here today is Jodi Duval, naturopathic doctor from Australia, Dr. Alan Bookatz, Chief of Emergency Medicine in LA, Dr. Jup Kuipers, General Practitioner from the Netherlands. I don't think that's how you say that, but our founder, Dr. Achacoso, currently in Washington, D.C., and myself, Dr. Scott Sherr. I'm an internist in just outside of Boulder, Colorado. So today, your clinical team is going after one question. Can a daily probiotic cure depression by rebalancing your gut ecosystem? In the next 25 minutes, plus or minus, you will get the cellular mechanism, the clinical protocol, and the one thing most practitioners get wrong about it. Let's go. Jodi, it's on you. Where do you start here?
So we need to frame this question with some precision now. We are currently witnessing an extraordinary rise in mood disorders. I think everyone is noticing it in clinic. We have seen it come through the doors much faster, I feel, in the last 5 years. Anxiety, clinical depression worldwide, conventional psychiatry. This answers from the conventional psychiatry point of view has remained unchanged for decades. So when we manipulate monoamine neurotransmitters at the synapse using selective serotonin reuptake inhibitors or SSRIs, this is where we've been focusing on for a majority of the time. So yet with clinical outcomes, it's disappointing. There's a high relapse rate, there's severe side effects. Meanwhile, the public, they're starting to realize that there is other things that they need to be looking at. The power of the gut-brain axis is really coming through, into social media and TikTok, and obviously the research is coming through as well around this. So it is leading to this massive rush toward the over-counter probiotics, because obviously the research is showing, great outcomes for this particular probiotic strain. We're giving some really good insight and some results, but it's, there's more to this picture. So, it is really that it's really not that simple, and it's not a quick fix for mental health. People really want it to be. So, Dr. Allen, in your practice, in your experience, you must witness a lot of the acute breakdown of this gut-brain connection daily.
Yeah, from the acute care emergency medicine practice, I mean, more than I'd like to, Jodi. I mean, someone comes in, they have depression, they have some type of psychiatric behavioral health type symptom, panic attacks, chest tightness, maybe they can barely speak at that time. We do the medical stuff, right? We run the workup, their EKG's fine, their labs are fine. We make sure that they're not, in danger to themselves or someone else. And then we give them something to chill them off, right? Take the edge off and send them home.
And
something like
sandwich. Don't forget the turkey
like
sandwich.
a turkey sandwich, some benzo, maybe social services, hopefully. And in fairness, that is the right call in that moment of, for what we're designed to do in the acute care space. And, I'm not arguing with that, but what we're really not asking is, why does this person just keep coming back, right? And was there anything underlying their anxiety that needed to be addressed from a medical standpoint? And I would call this, like, if they're displaying some type of anxiety, are their cells anxious for some reason? And could we investigate that?
Do cells have feelings, Alan?
I think cells absolutely have feelings. Yeah. And so
in various ways.
Exactly. And I think I have feelings too, Scott. So
I know.
Yeah. And I know you do too.
After all. So.
Yeah.
Yeah.
And I think what's interesting is, in conventional medicine, we tend to park that question in psychiatry, and the patient gets sent there, and then all of a sudden it's down a lot of helpful things like therapy, cognitive behavioral therapy, maybe medications, and that's fair, but it often just stops there.
Yep.
And I don't think anyone And certainly nobody is looking at what the gut is doing, right? Nobody's asking, oh, could there be a severe gut microbial imbalance that's triggering some type of systemic nervous system activation? And is that sending inflammatory signals that are just running constantly in the background, explaining, why this person is feeling this way? If their cells are in distress and having anxiety and panic attacks, then the system's going to feel that way too. It's like we're treating the smoke, but there's still this fire burning.
Yeah, man, I know. And so, yeah, how do you kind of see this in your practice?
Yeah, I totally agree with you there, Alan. And that's exactly where the mismatch lies. Conventional medicine, it treats the brain and the gut as these separate entities specialized into distinct departments like psychiatry, gastroenterology. But biology doesn't work in silos. The gut and the brain, they're intimately molecularly linked. And when we look at a patient struggling with mood issues, we have to ask a fundamentally different question. We shouldn't ask, what psychiatric drug can we use to suppress these symptoms? Instead, we have to ask, why is the gut-brain axis signaling danger? And how do we restore cellular safety to this ecosystem? What do you think about that, Ted?
Well, this is the core of Home Hope clinical framework, right? We have to shift our frame of reference from disease to health optimization. And this is where we must draw a sharp line between health optimization medicine and practice, or Home Hope, and functional medicine, which usually leads them to prescribe a complex stack of supplements to treat specific gut markers. But root cause is not enough if the root question is still disease. Pathogenesis is root causes of disease, salutogenesis is root causes of health. Similarly, we must distinguish ourselves from preventive medicine. Prevention is prevention of disease and still disease-centered. Health optimization is health-centered. Just because you're not sick doesn't mean you're healthy. It only means that you're not sick. To optimize health, we must evaluate the tripartite enteric microbiota gut-brain axis. It's not just the gut-brain axis anymore. It's enteric microbiota, gut, and brain at the metabolomic level. Therefore, the $64,000 clinical question of the day is, why treat depression exclusively in the brain when the signal starts in your gut? Let us unpack the exact biochemical and cellular mechanisms behind this connection.
Dr. Ted, back to you in a minute, but when we talk about the gut-brain axis, so most people think of it as just a really simple highway. I think it actually is nice to explain it in that way for our clients and patients, but it is actually a highly complex, multi-layered communication network. As with everything in the body, it is very complex, all interlinked. It all is a matrix, as I say. And so how do gut microbes biochemically dictate brain state and mood, which blows my mind, literally.
To understand this, Jodi, we must look at the gut microbiota through the lens of the term holobiontology, which simply means that the human is not an isolated organism, but is an entire ecosystem of cells, right? And symbiotic microbes. Within this ecosystem, gut microbes are active metabolic factories. They ferment dietary fibers into short-chain fatty acids, or SCFAs, such as acetate, propionate, butyrate. These SCFAs are not just local fuel. They are potent epigenetic signaling molecules. Butyrate, for instance, acts as a histone deacetylase inhibitor, crossing the blood-brain barrier to upregulate brain-derived neurotropic factor, or BDNF, in the hippocampus, directly supporting synaptic plasticity and mood regulation. Lots of jargon, but simply put, it means that there are molecules in the gut that drive the brain to influence your mood.
And so when that happens, when the microbial fermentation is disrupted, when that happens, how does dysbiosis alter that signaling?
When the gut microbiota shifts into a state of dysbiosis, right? Dysbiosis is merely a shorthand for the word dysbacteriosis. This is due to synabiotic exposure, and synabiotics are things that have never been encountered by your body before in evolution, like your new drugs, glyphosate, or chronic psychological stress. The protective mucosal barrier is compromised. Gram-negative bacterial outer membranes release lipopolysaccharides, or LPS. LPS is sometimes called little pieces of shit, into the local circulation. And this is where we say you have a leaking gut. So LPS acts as a potent endotoxin, right? Binding to the toll-like receptor 4, or TLR4, on immune cells. This triggers a localized acute cell danger response, stage 1, or CDR1. In CDR1, the cells halt aerobic energy production, stiffen their membranes, and release extracellular ATP or EATP as a danger signal. This local purinergic alarm activates the enteric nervous system and triggers the release of pro-inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha. So this simply means that when your gut is shifted into the ecosystem actually has overpopulation of some organisms and underpopulation of some organisms and doesn't maintain its ecological balance, you begin to have leaky gut, and then all of these endotoxins are able to enter into your bloodstream, right? And then your gut also will go into CDR1 or cellular response 1.
Let's bring that, what you just said, Ted, out of the gut and, really understand now what's happening in the skull or, in the brain. Because that's where I think things get really interesting clinically. And I think those cytokines you talked about, those inflammatory cytokines like IL-6, TNF alpha, they don't just stay there. They don't stay local in the gut. They don't just circulate in the bloodstream. They actually get to the brain, and that's really scary. They reach the brain, and there's these little organs that are technically, I guess, not part of the brain, but where the blood-brain barrier is actually quite permeable, and they call them the circumventricular organs there. And they're just a specialized grouping of brain structures. But once inside, they have like this direct access to the microglia. And I don't know about you, but I think of like the microglia as the brain's own like immune patrol. So normally they're like hanging out, they're quiet, they're in maintenance mode. And the blood-brain barriers, like the Marines, they're tough, they don't let anything really in. But when they pick up that there's this now systemic inflammatory signal that's playing out, they shift into this huge defense state. So they start releasing their own inflammatory mediators, calling for backup, creating their own recruiting. And that's, I think, what's really interesting is the brain chemistry starts to go really sideways. And we have this, like, for example, we see that there's this particular enzyme that's been implicated with the neuroinflammation that arises with this process. And it's called IDO, indolamine 2,3 dioxygenase.
Yeah, this is a really important point, Alan, because IDO activation is the critical biochemical junction. Can you explain a little bit how this actually works with serotonin production?
Yeah, of course. So the way I think of IDO is it's like it hijacks tryptophan, right? And so for those of you that know, that's the amino acid that your body uses to make serotonin and melatonin. It's the one that is often talked about during, the Thanksgiving meal and why we get sleepy. That's actually not true, but it fits for at least what we're describing here. So I want you to think of it like if IDO fires up, tryptophan then gets redirected down a different road called the kynurenine pathway. And this is what I was mentioning earlier. Two things happen, and neither's really great. First, you lose all your raw materials for making serotonin and melatonin. And then now your mood is disrupted, you have terrible sleep. And, if you talk to anyone in an inflamed state, that totally tracks. But second, the kynurenine pathway produces this other byproduct called quinolinic acid. And that is actually a genuine neurotoxin. And the way it acts on the NMDA receptors, which already are excitatory, and it overactivates them. It's like it turns the volume knob up on the NMDA receptors, and then it directly starts damaging neurons. And so that's actually where you start feeling, or when your clients or patients are telling you, like, I feel cognitive fatigue and brain fog, like that's actually where they come from. So it's interesting. And here's the part that really gets me is that in psychiatry, they see low serotonin and immediately we say, oh, that's the issue. And we reach for an SSRI thinking that that's going to be the root cause of their depression. And right. I guess if that was how you understood how depression worked, then the logic fits. But we know differently. And we know that if the serotonin's and that could be a reason for depression, but if the serotonin's actually low because, say, tryptophan is, which is this currency here, and no longer, is the system not under threat. So it's now taking this basic building block and shunting it now by these gut-driven neuroinflammation, then you're not really fixing the problem. You're just kind of working around it. Their model in conventional psychiatry is not necessarily wrong based on, I think, their approach, but it's just not complete.
No, conversely, when you take a look at leaky gut, then you should examine for a leaky brain, right? That's what they say. It's just that when you sense that there's the leaky gut, examine right away whether or not it's leaky gut, because usually leaky gut equals leaky brain.
But Alan, yeah, it's a really good explanation. I think it's really also exposes this really limitation of what we look at when we see that pathogenic drug first model, which you would see a lot of. And then in contrast, in sharp contrast, is the home hope cellogenic framework that really looks at how we can restore the cellular safety to the gut. So that when we're looking at that tryptophan that's shunted to the kynurenine pathway, we can flow back to that really healthy serotonin synthesis. We saw this mechanism recently supported by a landmark clinical trial, actually. So it was published in the journal Clinical Trial on the June 18th, actually, 2026, so very recently. And it was titled, So it was Efficacy of a Daily Probiotic in Relieving Depression and Anxiety in Older Adults. So in here, the research has actually demonstrated that a daily probiotic or a multi-strain probiotic administered over 12 weeks led to highly significant reduction in depression and anxiety scores. So this correlated directly with a drop in circulating inflammatory markers as well, and improved tryptophan to serotonin ratios, which is pretty cool. And so this then we're looking at as a direct clinical evidence, obviously within the limitations of studies, and everyone is a bit, we're all individual, but looking at the rebalancing of the gut ecosystem that relieves neuroinflammation and supports brain health and therefore mood. So, we look at this study, obviously it is a small clinical trial, so that was a limitation here. And the probiotic strains are also very highly specific. So when we're looking at the generic shelf-stable supplements, it may not be the same thing that we're looking at in this particular study. And I think that's what needs to be, we make sure that we communicate that specifically, is that not just any multi-strain probiotic off the shelf in a health food store or out of a supermarket will be the same as what they would be looking at here. The science, I feel like, we've talked through all of this, it's clear, and this is what I love about Home Hope, is that it all makes so much sense, but it never has been explored in this way from the context of the internal environment. And then obviously, we can't just change from an external point of view from this pathogenic disease management state. It needs to come from internally.
Pardon the interruption. This episode is brought to you by the 4th Annual Health Optimization Medicine and Practice Conference, happening October 2nd and 3rd in Chicago, Illinois at the Drake Hotel. You are all cordially invited to something that's not a typical conference. This is truly a community, and you'll feel that the moment you walk in. This is not wellness aesthetics, not disease management, dressed up in optimization language. This is actual, rigorous, measurable, deeply human health optimization. And it's a small group. Only 150 seats are available, and we've already sold out a lot of these. It's going to be an intimate gathering. If you want your ticket, you need to get it soon. We have a great lineup of speakers, including Dominic D'Agostino, JJ Virgin, Kiran Krishnan, Dr. Ted Achacoso, who's the founding pioneer of health optimization medicine and practice, myself, Dr. Scott Sherr, Lucia Aronica, an epigenetics researcher, Elizabeth Yurth, and many more. If you're a medical practitioner, we'll have at least 5 CME credits for you. And this is a room that's going to generally change how you practice and I think how we all live. So if you want a discount, we do have one, but it's only for a short period of time. Go to homehope.org and save 25% on your conference ticket by using code conference25 at checkout. That's homehope.org, code conference25 at checkout. Get it soon because we're selling out fast. I hope to see you there. Take care.
So we know that a dysregulated gut drives a dysregulated brain. But what does a Home Hope practitioner now actually do clinically to correct this imbalance? So what is the 1 cent solution, Dr. Ted?
Well, the solution must never be to throw a random probiotic to the patient, right? We do not prescribe
Especially not
lifestyle
at the patient. My
supplements
goodness, yeah.
from a slogan. Right? We prescribe precise cellular data. First, we run an advanced clinical metabolomics test, right? Like an organic acids test or oat test to measure markers like bacterial and yeast overgrowth, such as the arabinitol, benzoate, hippurate, right? You can also do a stool test, right? And if these markers are elevated, we know there's active dysbiosis. We also measure plasma amino acid profiles to assess tryptophan availability. And, as Dr. Allen mentioned, we can actually see the quinolate to kynurenate ratios to quantify the degree of active neuroinflammatory shunting.
Okay, so Ted, it's great to talk about ratios and all, but like okay, we have the data now, we know what's elevated, we see what's depleted, so and where the pathway is being pushed. Dr. Yup, tell us walk us through how you actually sequence this clinically. Like, what do you do next?
Yeah, so in clinical practice, the protocol we must follow is a strict logical sequence to establish safety first. We cannot simply plant new bacterial seeds, probiotics, in an inflamed toxic soil. So we start with phase 1, clear and unburden. We use targeted phytoceuticals and bioactive compounds to selectively clear microbial overgrowth and yeast overgrowth, while introducing high-dose oral binding agents to capture circulating LPS, little pieces of shit, antitoxins, preventing them from crossing the intestinal barrier. And then once phase 1 is complete, we move to phase 2, rebuilding the barrier. We support mucosal integrity using active amino acids like L-glutamine along with leucine-carnosine to heal these tight junctions, effectively shutting down the translocation of endotoxins into systemic circulation. And then we move to phase 3, seed and feed. Only after the local inflammation is dampened do we introduce highly calibrated multi-strain probiotics containing clinically validated strains like Lactobacillus helveticus or Bifidobacterium longum to actively downregulate pyrenuric danger signaling and support gut-brain axis communication. And we pair these prebiotic fibers like inulin or fructooligosaccharides to feed the symbiotic networks. And this structured approach we have, it ensures that the cells in the gut can transition from a defensive cell danger response to a healthy aerobic energy production and salutogenesis.
This is a perfect sequence, Yup, and I really do appreciate it because we really want to give listeners a practical, immediate step to apply. And here is our do it on this Monday protocol. So your next Monday coming up whenever you're listening to this, right? If you're struggling with chronic stress, brain fog, or low mood, do not start with high-dose probiotics. Instead, start by establishing gut barrier safety. Take 5 grams of L-glutamine powder in warm water twice daily, as an example, on an empty stomach to seal your gut's tight junctions and eliminate heated, highly processed industrial seed oils from your diet to drop local membrane inflammation. Only after 2 weeks of barrier support should you introduce a high-quality multi-strain probiotic to seed your gut ecosystem. Remember, this is what Dr. Yup just mentioned. This immediate step physically unburdens your enteric membranes, okay? And signaling safety to the enteric nervous system and allowing your mitochondria to restore baseline energy production. So this is a really key process and a step-by-step process that all of us can try, even without doing some testing if you want.
The 5 grams, Scott, that should be, in 1 liter of water and sip throughout the day, right? Don't gulp it in a single, in a single session.
Right.
And the second thing is that, you take this only for about 6 weeks or so. And the other thing is a warning, that you may get irritable with glutamine because it can be an excitatory neurotransmitter.
And I think a lot of people, especially with the parasite cleansers and all sorts that we've talked about in previous episodes, with the social media run, like you're literally, if you're clearing too quickly and you haven't, done your barrier, the little pieces of shit are going to travel everywhere and cause absolute havoc. So you've just got to think about that, people. All right. So I love this clinical sequence. It is definitely something that we all need to know about as clinicians. And as I said, we've seen it transform, clinical outcomes hugely. So, but in home ho, we always must maintain the balance, this absolute intellectual honesty. So we need to have a look at all sides. So let us deliberately steelman the strongest case against our own protocol. And what, therefore, would a serious conventional critic say, Dr. Yup, about treating depression via the gut microbiome?
I guess a serious conventional psychiatrist would probably argue that major depressive disorder is a highly complex multifactorial neuropsychiatric disease with deep-seated genetic, neurostructural, psychosocial underpinnings. And they would probably point out that while the gut-brain axis is a fascinating area of research, large-scale clinical trials proving that probiotic therapy alone can successfully treat severe treatment-resistant depression is still lacking. And probably they would also caution that relying on probiotics for dietary changes for a patient with active suicidal ideations or profound clinical depression is highly irresponsible, and that evidence-based pharmacotherapies like SSRIs and targeted psychotherapies remain the absolute proven standard of care. What do you think, Ted?
However, we are not evidence-based, we're evidence-informed medicine. We agree with the critique. We agree that severe acute neuropsychiatric crises require immediate conventional medical and psychiatric intervention. Home hope is not acute sick care. We do not treat acute disease. We operate in the domain of health optimization. If a patient is in an acute psychiatric emergency, send them to Dr. Bookatz. No, conventional drugs are necessary to stabilize them. However, once stabilized, conventional medicine completely ignores the functional metabolic matrix of health, leaving the patient in a chronic state of cellular dysregulation. Furthermore, we are not suggesting that probiotics are a monotherapy for psychiatric illness. We are demonstrating that you cannot optimize brain health if the gut ecosystem is inactively a cell danger response 1 state. We refine our position. Precision probiotic therapy must function as a foundational biological chassis to signal safety, upon which all other psychiatric and psychological interventions can succeed. And that's where we're called foundational medicine.
Let's sum it all up in a 1, 2, 3. Take home 1, 2, 3. So 3 standalone takeaways that we can apply immediately. Dr. Jup, you're first.
Takeaway 1, your gut is your primary neurotransmitter factory. Over 90% of your serotonin is produced in your gut under the direct supervision of all your microbiota. And so if your gut microbiota is in dysbiosis, your brain serotonin production is fundamentally compromised, regardless of how many brain-targeted drugs you take.
I'm going to go with takeaway 2. Yeah. So, right, you must seal your gut barrier so the little pieces of shit can't sneak in. So never throw high-dose probiotics into an inflamed, leaky gut. And I think you must, we must look at unburdening the gut. Let's help the body out a little bit here and support it gut first by clearing some of that overgrowth, the burden, and then sealing the tight junctions with the L-glutamine, which is the primary fuel source. And so before seeding that ecosystem with the beneficial bacteria, you're actually supporting it and giving it some support. Dr. Sherr, you're up next.
Oh, yes. So formula. Let's go with takeaway 3 here. So balance your biochemistry, not your symptoms, right? Stop treating cognitive fatigue and mood issues with generic supplements or stimulants even. Use advanced clinical metabolomics to map your specific organic acids and amino acid imbalances if you have them, allowing you to really prescribe precise orthomolecular support to shift your cells from defense to salutogenesis.
So, Dr. Allen, you are our expert today. Did you know that?
Read a little my called one. So this feels good trying this on for size.
Yeah, I know. I'm going to let you, try this uniform on today. So let's bring this discussion home, shall we? So how does rebalancing the gut ecosystem tie back to the foundational principle of health optimization, medicine, and practice?
It's a big one. All right, let's see if I can do this one justice. So ultimately, it goes back to a question that we just are not asking enough in modern medicine, right? What does healthy actually look like, right? For most of the system, healthy means you do not have an illness. You're not sick. You don't have a diagnosis, right? That means your labs were normal, meaning that that means just nothing was flagged. Nothing was out of the super high or super low ranges. So you're fine. Right? Or at least that's what we lead you to believe. And look, not being sick matters, but normal is not the same as being optimized. So, and that's an important distinction that we don't really talk about in medical school. The absence of a problem is not the same as the presence of optimal functioning. And in home health is that second thing that I just talked about. Cellular machinery is actually running the way it's supposed to, optimally. Not just quiet enough to pass a panel, quiet enough to just make sure things are functioning at whatever level of survival is required. And a big part of that, as the listeners are hearing, comes down to whether or not the cell feels safe. When a cell senses a threat, just like if any of us were to sense a threat, whether that's a toxin, infection, chronic stress, challenging relationship, traffic, who knows? I'm in Los Angeles here, right? It goes it goes into what we call the cell danger response. And you're going to hear us talking about this over and over and over again because it is key to everything that we're talking about, CDR. So, and it stops doing its normal day job, stiffens up, shifts into the defense mode. And that is the brilliant, wonderful short-term survival move, right? We absolutely need it. But the problem is when the cell gets stuck there. So we have tissues that are technically alive, passing every test, but we're locked in this defense instead of doing the actual work. So everything else with regard to repair, maintenance, all that is on hold. And so going back to what we talked about today, the gut microbiota is a good example of why this matters. It's not just this bag of germs that we try to manage or suppress, or supplement. It's this highly complex co-evolved network that's been doing its job for a very, very long time. And when those cells are out of danger mode and they're working, then the brain gets the signals that it needs to feel safe and think clearly and hold a steady, wonderful, positive mood that can maybe we'll say manage the traffic. But for us, when we use metabolomics to find where that network's actually breaking down, and then we correct it, we're not just quieting a symptom, we're actually coaxing those cells back out of the cell danger response, and we're bringing them into normal optimal functioning. And we're asking why the symptoms keep showing up in the first place. And that's what we continually go back to. And that's really the whole shift, that health is not something that we force. It's something that the body settles back into once the cell stops bracing for a threat that may have passed a long, long time ago.
Well done. Well said, Alan. And thank you all. Thank you, the whole faculty, for being here today. This is a perfect place to anchor our discussion. If you're a practitioner listening, thank you, whether you're a physician, naturopath, pharmacist, or health coach. And if you want to learn beyond, if you want to really move beyond the limitations of pathogenic medicine and master this clinical approach that we have here at Home Hope, you got to join us, or go to homehope.org to explore our academy, to enroll in one of our foundational principle metabolomic courses. There are multiple pathways. And, once again, that's homehope.org. You can check us out every week. Please don't forget to like and subscribe below. And to all of you, we wish you a great day. Thank you for listening.
Thanks, everyone. Bye.
Thank you.